Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today, we have a renowned gynecologist and obstetrician with 35 years of service, and that is none other than Parimala Devi. She is not only a robotic surgeon, she is also a colpologist, and more than that, she has done uh, set a world record, the Guinness World Record in screening the cancer patient, that is cervix patients. But what is important is, though she is with the advanced technology, she is concerned about the women and preventive portion. And especially she is known for the preventive oncologist. And so let us welcome Dr. Paribala Devi.
Thank you, madam. Thank
Most of the people, they start preparing when everything is worse. In fact, it is said, a good doctor is the one, the best doctor is the one who prevents the disease.
I will start this talk
Yeah.
because
Okay.
prevention is better than cure. We always want to do some kind of prevention to prevent diseases because most of the women, especially I'm telling around 40 plus, the metabolism of the body comes down and lot of hormonal changes will happen. The women are nothing but lot of hormones. At the time of menarche, there are some hormones which are actually initiating the menstruation and they are trying to help the ovary to produce good eggs. And at the reproductive period, there is another hormone like progesterone, pregnancy hormone. And again, the time of menopause, again, the estrogen hormone, its variants, all these things, woman has a type of very much like a very versatile type of hormonal pattern, but sometimes troublesome also. So it is our duty to highlight prevention is better than cure because penny wise pound foolish it should not be. Because if you want to spend just some few rupees for the prevention, like for example, pap smear, but afterwards, if they don't know about the disease, what they're having, they may have to spend in lakhs together money. So we have to make the awareness that prevention is one of the important thing. I am very happy because I am a preventive oncology specialist, wherein even though robotic surgery, these are all advances, said when we do them, when there is a developed cancer already, when there is a disease, but here, before when a healthy person walks inside, we have to alert them, are you very healthy? Are there any problems which are there in your body? That is called as screening actually in English.
Any chances of developing disease can be
Developing disease.
detected, and
Yes.
that can be prevented by vaccines. So you start with
Yes.
the vaccine. Which
Yes. Yes.
condition has got the vaccine
Yeah.
and when it has to be given?
Yes. Cervical cancer is the one cancer which has got vaccination. No other cancer is having the vaccination because in cervical cancer, the causative agent that is the culprit human papilloma virus is found. This is the virus which is causing the cervical cancer. So we have the vaccination. Even though vaccination has just started since some about 4 years or so, it is preventing nearly about 80% of the cancers in the women when it is
Yes,
given at the proper time before the marriage. But
both
once
for
they
boys
get
and the
married
girls.
and they deliver and go ahead, that time
Hmm.
also we can give vaccine, but it may control the disease by 40-50% because already
Okay.
the cervix may be having some kind of ulcers because of the
Hmm.
delivery, because of the
Hmm.
infection. Some of
Hmm.
the sexually transmitted infection also can happen. Because
Hmm.
of that, we have to take what is called as important is pap smear.
Hmm.
Pap smear is the one which we take from this mouth of the uterus, from
Hmm.
where that pap smear will tell us is there any human papilloma virus, what
Hmm.
causes the cervical cancer, with it is persisting in that.
Hmm.
Just infecting is different, but persistence of the virus in that
Hmm.
area again and again
Hmm.
can cause cervical cancer nearly about 4 to 5%. So this is
Okay.
one pap smear is one test what we want to do in the preventive oncology.
How
Next
much
is
does it
breast.
cost? How much that pap
Actually,
smear
pap
cost?
smear it can cost from some 700, 800 rupees to 3,000
Yeah,
depending
that is
on the
nothing
hospital.
more. It
Yes,
is not
they
much.
should they
Okay.
should be able to, even in IMA government institutions and all, it is
It's
done
done
freely
free.
actually. It's done
Okay.
freely. So like that, pap smear is one very important preventive screening for women. Like
Hmm.
that, breast examination and breast self-examination awareness and ultrasonography of the breast and mammography. Self-examination, I want to highlight, we have to teach the young girls only from 20, 22, 25 years only to
Hmm.
examine their breast every month, at least possible, at least every 2 months. When they are
Hmm.
about to take bath, usually we don't have any clothes on our body. That time they can examine their breast from the opposite side of the hand all the four quadrants of the breast, and also the axilla, because the mammary
Mm,
gland usually extends up to the axilla, the mammary
mm,
line we say. So there
mm,
also the breast cancers can come. When there is a
mm.
breast cancer in male, it is nothing very surprising that in axilla the breast cancer can come for the female. So because
Okay.
we have nearly about 1 in 25 women having the breast cancer, the first cancer. So
Mm,
prevention is the best thing for breast cancer. In the
mm,
self-examination, if a woman follows or a girl follows,
mm.
usually 60 to 70% they can prevent their cancer because they come early. They come and tell their
Okay.
gynecologist, doctor, something I am
Mm.
feeling, doctor, you please see.
Yeah.
That time it may be just a benign one only. It may not be malignancy. All the small tumors, what you feel in the breast, may not be cancer.
Like a mouse
It
in
is
the breast, they are
mouse in
just
the breast,
mobile and moving,
fibroadenoma.
may not be,
Yes,
but still, better to
yes.
prevent. Okay.
Yes, especially hereditary if it is there in the family, mother is having. Just now, put half an hour back, I had a patient. Mother had intestinal cancer. She is
Mm,
worried where she is getting some cancers because they're all interrelated. Breast,
mm,
intestine, and ovary, they're all interrelated. So
mm.
again, we had to counsel them and send like that. But in women who are more than 40, where there are more chances of immunity coming down and there is a hereditary, we are supposed to do mammography and
Mm,
ultrasonography of the breast, because in that we can find out is there any small tumor is there, so and we
mm.
can alert them. It may not be, and we may take a biopsy then and there only and make them
Okay.
very healthy. Like
Yeah.
that, we have
So
what is
even in
called as
the
abdominal
earliest
scanning
stage,
also.
in the stage one itself, you can detect. That
Yes,
also is
yes,
prevention, because
yes,
until it
prevention.
becomes saya, in the early
Yes,
stage when it is just about to start, at that time also, if the biopsy is done or the colposcopy is done, you can
yes,
also prevent the future.
prevent.
Okay.
And
So,
also
okay.
abdominal general scanning where the ovaries will be seen. These are two organs which are very important. These
Hmm.
andashaya, whatever the ovaries we say, because
Hmm.
their cancer is very like violent it
More
is once it
dangerous.
comes.
Yeah.
It is
Very
more than
malignant.
55, 60 years. They have to be very alert.
Hmm.
So in a health checkup, pap smear and breast examination, self-examination awareness, and ultrasonography. And sometimes
Hmm.
if at all required, the chest x-ray, like we cannot forget tuberculosis still. Still
Yeah.
tuberculosis is existing in our country. So doing a
Yeah.
chest x-ray and
Hmm.
cardiac some markers, all these things are very important. But
Hmm.
still the awareness is not to the mark. Our
Hmm.
people have to understand about the preventive health checkup, because the metabolism and the hormonal levels play a big role in women especially. And then
Yeah. Yeah.
even though males are having the other organs like prostate and other things, but in women, especially the reproductive tract organs are very important and they contribute nearly to the about 60% of the cancers, we can say. And lot
Okay.
of women are
Okay.
living with the longevity now, because one
Yes.
third of
Yes.
the menopausal women are there in our country, in our population.
Yes.
So a
Yes.
lot of cancers are diagnosed now as the immunity is
Yes.
coming
Yes.
down.
Yes.
The
Yes.
hereditary also is there. So prevention actually has a big role. Only thing it is to be accepted by the people, and they have to see
Okay.
that, and they have to what you say like in your channel, madam, like ahara, arogya, and all these things, adhyatma. They have to cultivate the habit of exercise and diet,
Mm,
sattvic ahar. Jaise annam vese tan vese man, we say like in
mm,
Sanskrit.
mm,
So they have to follow all these things. Means relatively they can be more healthy. That's what we want to highlight in the preventive health checkup things, even though they are
okay.
commercialized a lot, but still
Mm,
whatever necessity, you can go to a small one clinic or some your own doctor whom you are familiar and get yourself tested and you can be healthy.
mm. Yeah, yeah. This is really very important, stitch in time, they say, saves life.
Yes,
But here,
saves life.
test in time saves the whole disease and prevents the
Yes, yes,
disease. So
yes, yes,
that is
yes,
really very, very important points you have told. So especially in women, the breast cancer, the cervix cancer, uterus cancer, and also the
ovary.
ovary cancers,
Yes,
which go undetected, and that should not happen. And the women can prevent all these things and detect
yes,
in time.
yes,
And that's
yes,
the reason, if they take care of, their suffering will come down, and the
yes.
expenditure also will
The
come down.
morbidity, mortality we can bring down.
Both will come down, both will come down.
Yes,
And what is important is, woman is very important for the family. She is like the
yes, yes,
cementing force, she is the pillar of the family. And if something happens and if she goes down, the
yes.
whole
The whole
house
family will
collapses,
collapse.
your whole
Yes.
family
She is
collapses.
the
And
nucleus of the family.
Yes,
It's something
yes,
like a galaxy of the stars. She's in the
yes.
center. All stars will
She
be
the
moving
sun,
around
she
her.
the sun, like a sun. And so, we have to be very, very careful. I think the women should change their attitude. And it is said, if you change your attitude, the whole
Yes,
scenario changes. And that's how,
yes,
we women should protect ourselves and then see that, tell others also to protect so that they don't get into miserable
yes,
condition and
morbidity.
then die at the end stage.
Yes.
So
Then
always,
the repentance will not help. They have to
yes, yes,
prevent it.
yeah. And
And
that's
even
how
economical burden also increases for the family. If at all she develops
yeah,
real frank cancer, then taking her for surgery,
correct.
chemotherapy, radiotherapy, everything, a
All,
lot of
yeah,
economical
everything.
burden also will be there.
Not only economical burden, the misery and the suffering and the whole family,
Yes, yes,
it
yes.
becomes like
It is unimaginable,
havoc.
madam.
It is
Yes.
unimaginable and unfathomable. And so in Hindi, it is said, no, सब कुछ लुटा के होश में आए तो क्या हुआ. So better to, when you are in hosh, only see that nothing happens to you, and take the precaution. And what you spend for precaution is peanuts compared to what you
Yes,
spend
yes,
when you are suffering with the disease.
yes,
So thank
yes.
you very much for
Thank
such
you, madam. Thank
beautifully
you.
explaining and the importance of preventing the diseases in the
Yes.
women. Thank you.
Thank you, madam. Thank you.